Good afternoon and welcome to day 389 here at the St. Clair County EMA office, bringing you our daily COVID briefing. I'm joined today by Chairman Mark Kern and Samantha Bierman from the Health Department. Sam, thanks for joining us today.
Thank you. So as of today, we have tested 318,183 St. Clair County residents, which is an increase of 561 from yesterday. We have 29,557 positive test results, which is an increase of 30 from yesterday. And that does include both males and females from under the age of 10 up to their 70s. Our daily county positivity rate today is 5.3%, and we have 288,626 negative test results. We have no new additional deaths today, so we still sit at 472. And for those who have completed the 10-day isolation period required by IDPH, we have 28,798. For state totals, 20,737,823 have been tested, with 1,261,667 positive test results, which is an increase of 2,931 from yesterday. And for deaths, the state is reporting 21,395, which is an increase of 13 from yesterday. For hospitalizations in St. Clair County, currently we have 18 patients that are admitted due to COVID-related reasons, and one of them is on a ventilator. And regionally, we have 39 patients that are admitted due to COVID-related reasons, and 2 of them are on ventilators. We only have one change in our long-term care facility and congregate living facility list today. And please remember, these are cumulative numbers, and will only announce the facilities that have had changes. Willow Creek in Belleville has 14 cases and 2 deaths, and that is an increase of 1 case for that facility. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. So testing is still available,
Yes, it is.
and we encourage everyone to go out and get tested at the mall. What
Yes.
are the days of operation there?
Monday, Wednesday, Friday. So please do check the days before you head over. We would hate for you to get there on a day that they are not open.
Right, and then Walgreens and CVS
Yes.
still are testing. So tell me about how it went today with the basically drive-through without an appointment and get set up there and get your vaccine at the fairgrounds. How'd that go today?
It went very well. So the way we did it was when you came in the main gate, if you had an appointment, we sent you to one lane, and if you didn't, we sent you to another. The ones that came with appointments went through the normal process, scanning of your QR code, and then sending you down to checkpoint B for your final check-in. If you came without an appointment, you simply stopped at checkpoint A, and someone was there to help you set up an appointment, and then you followed down to checkpoint B. We did have approximately 300 more individuals that came today with that option being available, not having to make an appointment. And I know obviously we are closed tomorrow, so please no one show up tomorrow, but Thursday and Friday from 9 a.m. to 5 p.m., we will be offering that again. So you can show up without an appointment, and we will be happy to help you make one when you get there.
Great, and you'll be giving Pfizer vaccines on Thursday and Friday.
That is correct, yes.
And then this weekend Saturday, are we doing Johnson & Johnson?
We are doing a Johnson & Johnson clinic on Saturday, and that will be the 10th. And again, Johnson & Johnson is the single dose vaccine, so one and done. And we will have approximately 2,500 appointments open for Saturday.
So that you don't have to have an appointment Thursday and Friday.
That is
But
correct.
Saturday, we still think you may have to have an appointment.
Yes.
And really, it's because of availability of vaccine, and Johnson & Johnson we have in different quantities than we do Pfizer.
And we don't want anyone to be waiting and not be able to receive a vaccine. So yes, we're just going to err on the side of caution. We don't want anyone waiting unnecessarily.
But we encourage people Thursday and Friday,
Yes.
even if you don't have an appointment, go to the fairgrounds and we'll get you signed up and get you through. The best thing to do, though, is to get online, sign up before you get there, and then you're in the express line, and it goes a little more quickly for you.
And even with opening to those that didn't have appointments today, people that were going through, wait time was only approximately 30 minutes, and that was start to finish, including your observation time. So by having that available did not add any time onto your length of time you were there.
That's great. Team St. Clair, and I know Brian was a big part of the logistics. Brian Whitaker, thank you for entering into that and creating the 2-lane scenario. That makes everything work much more smoothly if people who sign up ahead get to go through and have priority.
And as we've talked about all along, the main goal there is we are constantly evaluating the process. How can we streamline it? How can we make it better? That's where the conversation came up about, can we make this to where those without appointments could still show up, and we're able to make it work. I'm sure we will tweak it as the process continues to move on, but definitely something we're going to keep evaluating, because at the end of the day, we want to get as many people through there as possible to get those needles in the arms.
The goal is to get our positivity rate as low as we possibly can. Get it to negligible levels so that we can all get back to normal. Only way to do that is with a firewall. The firewall is created by people who are vaccinated.
And like you mentioned, the appointment process is still available and highly encouraged. Those today that had appointments were in the gate and to the vaccine tunnel getting a shot in less than 5 minutes. There was a 5 or 10 minute longer process to get in, get registered, etc. But that process is going to be streamlined even more, and we'll be to the point that anybody that wants that shot can get it.
And the people who've waited until day 389 to get a shot, they really they're taking advantage of all the experience now that has been going on, all the guard and the health department workers and all of the people there from the county that have been part of this. Everybody knows how to do their job a little better every day, and so it just gets a little faster and a little faster to get it done. So you need to,
You
Randy?
can also use the call center if
Yeah.
you need assistance.
Please use the call center. Randy, the number?
825-4447 or 509-6010.
Thank you, Randy Randolph, for that number. We appreciate that. And we'll post that also.
Yes.
Okay, let's take a look at the zip codes, because I know that's what all of you are waiting for. 62201 up 1 to 588. 62203 up 1 to 632. 62204 up 1 to 403. 62205 up 1 to 646. 62206 up 2 to 1321. 62207 down 1 to 593. 62208 up 5 to 1666. 62220 down 1 to 2117. 62221 up 1 to 2820. 62223 up 2 to 1784. 62225 up 1 to 144. 62226 up 2 to 3247. 62232 up 1 to 916. 62243 up 1 to 789. 62257 up 1 to 347. 62264 up 1 to 371. And 62269 up 3 to 3,322. 30 new positives today. 561 people tested, makes that county positivity 5.3%. That goes up today to 5.3. Therefore, the rolling average, the 7-day rolling average in St. Clair County goes up to 4% today. Regional positivity, though, stays the same at 3%. Bond County calls in at 8% today. Clinton County's at 0%. Madison, 7.7%. Monroe's at 20% today. Randolph is at 0%. St. Clair is at 3.9%. And Washington County, 11.1%. So, get the needles in arms. I think the fairgrounds site is once again proving to be a very successful place to go for people. Easy in, easy out, easy access, and a fairly painless way to get vaccinated.
Absolutely. And the best thing you can do, the most comfort you can be, staying in your own vehicle, not having to get out. That whole process from start to finish, as Sam mentioned today, is down to less than 30 minutes, and that includes a 15-minute wait time. Now, some people, because of their medical conditions, have a 30-minute wait time, but still, they're getting through that process as quick as someone could park their car, get out, walk into a business and get registered. So definitely moving very quickly.
And Brian, one thing I want to add, I know there may have been a little confusion in the verbiage used. It is still a drive-through clinic for the, what we're calling a walk-up, no appointment needed. It is still a drive-through, for the vaccine. So do please keep that in mind.
Yeah, I think the newspaper's headline says walk in. It's not walk in, it's, you can come there and get served, but you're gonna be served in your car.
And if you need transportation help, we do have the Metro bus that can pick you up and bring you to the facility. That is always an option that we have for those.
And at that point, then you will be walking in, but you have to come in on mass transit to have a walk-in appointment.
And a couple things that we always want to reiterate, some questions that have come up today. You do have to live, work, or go to school in Illinois
That is
to still meet the criteria. Currently doing Pfizer, 16 and above. As you mentioned, Johnson & Johnson on Saturday, 18 and above.
That is correct.
So important to understand that if you're 16 or 17, you must get that Pfizer vaccine. So they won't be eligible on Saturday when we're doing Johnson & Johnson. And another question that came up today was, since I didn't make an appointment, I want to show up and just get a shot without disclosing who I am, and that unfortunately is not allowed. We have to track who the vaccines were administered to, and then the follow-up to get those second doses. So even if you are showing up, we still must register you once you arrive at the site.
And Pfizer and Moderna, as Team St. Clair knows, but maybe there's someone that's a little confused. Pfizer, Moderna require 2 shots. Pfizer is 3 weeks from your first shot. Moderna 4 weeks from the first shot. Johnson & Johnson, though, is a one-and-done process. So many prefer Johnson & Johnson because they only have to go once. Some like Pfizer, some like Moderna. I think it's all good.
Absolutely. So we thank you for joining us here every day. We will be back with Cindy in a few minutes to translate this to our Spanish communities, and then we'll be back tomorrow for day 390. Thanks for joining us.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.